nephrogenic diabetes insipidus, right? That's the most common side effect we see in lithium. So 50 to 73% of patients using lithium long-term will end up.
Well, like the pathway on this, I don't know, but I mean, definitely for anyone who's on lithium.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of the Kidney Disease Solution, Kidney Mastery Program, Kaigenesis, and Kidney Coach. And I'm joined again today by one of my favorite guests to have is Jessie Anna Seville. Jessie Anna is the CEO, the founding renal dietitian of Kidney Nutritional Institute. So she has a great big organization over in the US there that works specifically with people diagnosed with kidney disease and looking at dietary interventions as well as nutritional interventions and how to help people better live healthy, full lives when they've been diagnosed with kidney disease. And then there's a very specific thing that can happen in lithium-induced toxicity, which it looks like, what do they call it? It looks like diabetes, right? It's lithium-induced nephrogenic diabetes insipidus, right? That's the most common side effect we see in lithium. So walk me through, and they're saying in 50 to 73% of patients using lithium long-term will end up getting this.
Wow. Yeah, I don't know. Like the pathway on this, I don't know, but I mean, definitely for anyone who's on lithium, right? It's not that you come off of it right away. It is that you understand where the risks are and you have monitoring and you have some strategies, which we'll talk about in a second, to reduce the potential for toxicity. Because if it's going to cause kidney damage, nephrogenic diabetes insipidus, like those are going to be problems, right? Big problems later on in your life. And the thing is that sometimes when you create scar tissue in the kidneys, right, or in the pancreas, sometimes that scar tissue can get turned around, but not always. And that's where you get kind of that permanent damage. So being proactive early on is really like the name of the game with that lithium. And being able to really dig deeper if you're using it for bipolar. Sometimes it's just, like I said, it's very, very effective treatment. It's really, really important. But even with like mental health, there are underlying causes, other nutrient deficiencies, and we like treat with antipsychotic meds and we haven't addressed the underlying cause. So
for sure, I think that's a really pertinent point.
Another topic is mental health and that sort of thing. But on lithium, right? Knowing what you can do to prevent the toxicity, I think is really key.
Yeah, and it's interesting. I'm just looking at motor mechanism here. So they're saying that what happens long term, this goes back to this whole sodium thing, I think, is that in induced nephrogenic diabetes insipidus, what happens is the kidneys can no longer concentrate the urine. So then people get excessive thirst. So then you're drinking more, you're diluting more. Then what happens, you get vasopressin and antidiuretic hormone that regulate the balance of fluid intake go completely out of whack. So you get ADH levels are decreased and then the kidneys start to produce more urine. So you're just getting these kidneys completely working overtime. So lithium interferes with ADH signaling pathways in the kidneys, and that interferes with the normal function of the collecting ducts within the kidneys, which are critical for water absorption. So lithium enters the cells at the collecting duct through the epithelium sodium channel, which we were mentioning before. And that is where, because it's not sodium and because the kidneys are thinking it has this complete inhibition on ADH. And then glycogen synthesis kinase 3 activity and CCAMP, which we know CCAMP right in polycystic kidney disease. That's one of the mechanisms of CCAMP causes dilation in the tubules. And then you get that dilation all the time. And then if you're eating lots of oxalates, then the stones, they dilate to let the stones through, but then you get this permanently dilated kidney nephron, which then stretches it all and it gets a whole pile of damage to it. So I think it must be that pathway that it's going about, but it's, it is reversible early in treatment, but as you said, it can become irreversible over time, the more stretch and damage and fibrosis processes that starts happening to that kidney tissue.
Absolutely. Yeah. I mean, that is a brilliant description. That's why I love to come work with you and talk with you, because like, that's right? Like if it is replacing with sodium, that would make sense.
If you want to know more about what we do, make sure you head to kidneycoach.com. You'll find us on Facebook. and Instagram. Make sure you hit subscribe and like. That way you'll get notified anytime we put up new content. And if there's any topics that you want Jess and I to tackle, put them in the comment below and we will add them to the list of things to talk about. Jess, pleasure as always. Thank you. Thank you.
Yep. All right. Thank you so much.